the aorta leading out the heart, right? Okay, the first branch off on the right-hand side only is the brachiocephalic. There isn't a brachiocephalic on the left-hand side, only on the right-hand side. And this is true only in the artery system. Now remember when we talked about you have 10%, that would be an anomaly. It's possible for these guys to be different in you. Okay, but normally most of the time they're going to say that this is the drill, this is the way it works. So on the right hand side you got a brachiocephalic. The very first one going off and going up is common carotid.
You got to point out like where it is.
Common carotid. See where sign has an external and an internal and a common? I get a common carotid going up. It's going to branch, and part of it's going to go on the inside of the skull, part of it's going to stay on the outside. If it stays on the outside, it's the external. If it goes on the inside, it is the internal. Very good. Then we're going to go on down here a little ways. Going up in the back is the vertebral. Now, do you guys remember cervical vertebrae? Remember how they look different?
Yes.
Spine was split in the back, and the side wings had those holes on them, the transverse wings on the side. These guys run up those holes in there. So they're running up and down in there, and there's nerves in there and stuff too. So they're protected by the vertebrae, and they're going in the back. And we'll talk about where these guys go to when we get to this thing called the circle of Willis in a couple slides. Okay, after those guys have given off, it's going to continue on down. It's the same vessel. This is where it's a little weird because it's going to be the same tube, but the names change depending on where it is. All right. So as we're going on down, it goes underneath the
subclavicle artery.
It goes underneath the clavicle, so it's the subclavian artery. Okay, and then it gets into your armpit area. So then the name is now the axillary. I'll use this side over here because there's less stuff. So you're going through subclavian over here to the axillary. Then it gets into the brachial part of your arm, right? Remember the top part was brachium? Okay. It's the brachial artery. Gets down to your elbow, splits. There's a bunch of other things in here, but for right now, this is what we're going to worry about. The part that goes along the bone to your thumb, what would that be?
The
radial.
The radial artery.
The part that goes along your little finger side would be the ulnar.
Ulnar.
Awesome. Now you're going to get down to your palm. There's two loops. One is deep, one is superficial. So one's the deep palmar arch, and the other one is the superficial palmar arch. Then coming off, you're going to have digital arteries. Now I'll show you the cadaver shots on some of these things Thursday, right? Especially when we get to the mesenterics and the tongue, because I mean it's pretty hairy looking stuff. There's no brachiocephalic over here, remember? So what comes off over here? You've got the aortic arch as it comes up and around goes down. First one off on that side is going to be carotid, subclavian. And then the aorta itself goes down. When it gets down into here, it's going to get a little weird. You've got three major unbranched vessels that come off, and they're related to the embryo. Because in the embryo, you're going to find that you have three guts. You've got a foregut, a midgut, and a hindgut that evolve into these intestines and stuff. The very first one that comes off supplies the blood vessels of the old embryological foregut. It's called the celiac. And we'll talk about that when we get to the more detailed part of it. Then the next big one is going to be the superior mesenteric. And it's going to catch the midgut. It's going to catch small intestine and part of the large intestine stuff. Then the one after that is the inferior mesenteric, and it's going to catch the rest of the intestine stuff. And some of the sigmoid and the superior rectum. Now, in addition to those guys, you've got going after the kidneys. They're going to be renals. Okay? Left side is higher than the right side because the liver pushes stuff down on the right side. Right in here, you're going to have gonadals coming up. Embryologically, your gonads start really high, and then they migrate down. Okay, so the blood vessels have to start out high with them, and then they migrate down as the gonads migrate down. So you've got this abdominal aorta, it's got all those branches, then we're going to get down here, and it's going to split. And you've got this one right here. Only this part right here. is the common what? What do you think it is? Common iliac. Okay? But it's only for a little distance because then you're going to have some little branches that are going to come off. And then it's going to break out into the internal iliac and the external iliac, right? And then we're going to continue on down and it's going to turn into the femoral. Then it dies behind your knee. Remember that region behind your knee? Popliteal or popliteal, depending on where you're from. Okay? So you've got that. Then you got a major branch that goes along the tibia in the front, and a major branch that goes along the tibia in the back.
Anterior and
the one that goes along the tibia in
posterior.
the front would be the tibialis
Anterior.
So that means the one that goes in the back is
Posterior
the
tibialis.
posterior. Awesome. Then you get down here. You don't have this kind of stuff down here, but you do have an arcuate. And the digitals are going to come off the arcuate down there.
So we need to know all of these pretty much?
Everyone I talked about.
Can you go over them?
But some of these guys over here, we're going to get into some details on in a little bit.
Can you just tell us all those?
Okay, basically all of these up. Now,